Thank you so much, Hannah and Prime Minister Rudd, for that conversation. Our next conversation I was thinking about a little bit earlier, and I feel like if we had this conversation a year ago, it would have been a good conversation to have, and people would have taken it seriously, but I don't think it would have the same weight as it does today. So, for our next conversation around investing in a healthier tomorrow and the link between health and economy, in partnership with the Global Initiative for Health and Economy at the U.S. Chamber of Commerce, please welcome Michelle Williams, Dean of Faculty at the Harvard T.H. Chan School of Public Health, Mohammed Ali Pate, Global Director of Health, Nutrition, and Population at the World Bank, and Executive Vice President and Head of International Affairs at the U.S. Chamber of Commerce, Myron Brilliant. Myron?
Thank you. As you heard, I'm Myron Brilliant. I'm the Executive Vice President of the U.S. Chamber in charge of International Affairs, and I'm delighted to be back at the Concordia Annual Summit today to moderate what I think is going to be a fascinating conversation on investing in a healthier tomorrow. It is correct, in the midst of a global pandemic around the coronavirus, that all of our attention, government's attention and private sector, is on finding the vaccines, finding treatments to get us out of this global pandemic. But even in the midst of this pandemic, it's important and it's an imperative not to lose sight of other diseases that we have to confront as a global society. And so here today, we're going to focus on a different crisis, non-communicable disease, NCDs. This is something that annually kills more people than the coronavirus will. Many have referred to NCDs as the silent pandemic. Conditions such as diabetes and cardiovascular disease, cancer, together kill more than 40 million people each year. We're also seeing that the most susceptible to COVID-19 are, in fact, people who have NCD-related issues. 5 years ago, the Chamber of Commerce, an employer-based organization, the largest of its kind in this country, we started thinking about how we can make a difference, an impact on the growing rates of having on the workforce, frankly, and economic growth. The Chamber launched, as you heard, the Global Initiative on Health and the Economy to promote public-private partnership and increase investment in health as a strategy for economic growth and development. Early this afternoon, we actually held a longer strategic dialogue where we released a new study that assessed the economic and social returns to investing in health interventions for chronic illnesses. The report actually examines 27 countries and finds that for each additional dollar invested to combat NCDs globally, there is around a $20 return. That's worth making the investment, lower the health risks that we face globally. You can find out more about our strategic dialogue at the U.S. Chamber's booth. Now, let me turn to two special guests. You heard them introduced. Dean Michelle Williams, who is the Dean of the Faculty at the Harvard T.H. Chan School of Public Health, and of course, Dr. Mohammed Ali Pate, who is the Global Director of Health, Nutrition, and Population at the World Bank. Thank you both for being with us here today. We're excited to look forward to your comments. I want to turn to you, Michelle, Dean Williams first. Let me ask you to walk us through the NCD crisis today. What are we facing? Why is it such an important issue that we focused on?
Great. Thank you, Myron. It's great to be here. It's a privilege. Let me just say that this COVID pandemic really lays bare for us to see just how important it is to invest in public health, global public health, to invest in preparedness and response. Because at the core of public health is really ensuring that our human capital and that our public health systems, our healthcare systems, are well invested in and positioned to prevent our health and our economic and security come to a full stop, which is what the pandemic has really uncovered for us. Just briefly, NCDs, non-communicable diseases, chronic diseases, if you will, which were once regarded as diseases of the affluent. You mentioned them. You mentioned heart disease, cancer, chronic respiratory disease, diabetes. These were once regarded diseases of the affluent. What we know now is that NCDs are also diseases of poverty. The major drivers of these diseases are social determinants. These are factors that are consistently, regularly thought of as the factors that are way upstream from our health system. These are factors related to where we live, our housing security, how we work and where we work, the types of foods we have. So globally today, NCDs are responsible for 7 out of 10 deaths worldwide, more than all of our communicable diseases combined. And we know that these diseases, these disorders account for a third of the burden of disease in developing countries. In fact, in developing countries, more than 800,000 deaths per year are among younger people, which is more than deaths with HIV, tuberculosis, and maternal deaths combined. The factors, again, that contribute to these NCDs are quite diverse. These factors are social, they're economic, they're environmental, and they're also structural factors. They include poverty, they include the unequal distribution of economic opportunities to secure proper housing, clean water, healthy food, and green space for physical activity and health and wellness. There are individual factors as well that drive NCD, and these include um, migration, urbanization, decreased physical activity, increased consumptions of high caloric diets, and tobacco use are just examples. Now, there are significant economic consequences to the inattention to preventing and controlling NCDs. At the familial level, where out-of-pocket payments to manage these disorders will take place in the context of lack of access to universal health coverage, NCDs can be the medical driver towards poverty in households. And on a national level, with significant economic consequences of lack of attention to preventing and controlling NCDs can decrease economic development in communities and in countries. I'll just end with this one statistic that the Institute of Medicine 2 years ago found that NCD costs developing countries upwards of 5% of its GDP. That's greater than the economic burden of malaria and AIDS, malaria in the 1960s and AIDS in the 1990s. So the bottom line is NCDs are a threat to individuals, economic development of countries, and are really in preventable conditions that if we invest in universal access to care and we invest in health systems that promote health and wellness, we could control these chronic conditions.
Michelle, thank you. You talked about the factors that have led to a rise in non-communicable diseases around the world. You've talked about the economic consequences. Dr. Pate, I want to turn to you because you have a leadership role now in the World Bank, but you've also been a minister of finance of Nigeria. The reality is that ministers of finance have this perception traditionally that health is a cost, rather than looking at the link between health and, of course, a healthy economy. And I think we've seen now with COVID-19, clearly you cannot draw a line between health and a healthy economy. So how do you advise governments now to look at making strategic investments in health to deal with the kinds of issues that Michelle was saying, which is we have to prevent the rise of NCDs, and that is going to require government intervention. So, Dr. Pate, maybe you can offer some thoughts.
Yes, no, thank you. Just a slight amendment. I served as minister in the health ministry of the federal government of Nigeria a few years ago. But thank you for having me to join this conversation. We are facing an unprecedented global social and economic crisis, but the root of that crisis started in the health sector. Only a fraction of the world's population is affected, but the entire population of the world has been affected by the economic consequences of the pandemic. That points to the need for investing in health systems as a basis for protecting public health and also leaving no one behind. Inequities in how health is organized and financed comes to bite everyone. And stronger health systems are very much linked to national and economic security, and as Michelle mentioned, are key to accumulation of human capital. We approach it from the point of view of the whole life cycle, from gestation to childhood to adulthood and also to healthy aging. And so in our engagement with countries, we engage with that perspective in mind, and the World Bank being a multi-sectoral institution, even though it's a financing institution, with that perspective in mind. And NCDs in particular pose a huge burden, including the cost of care and on the overall economic growth, as your study has sort of illustrated very clearly. The World Bank engages through its analytical and advisory services to countries, its knowledge and experience that it shares with countries, but also in terms of the partnerships that it forges with other entities, bilateral, multilateral, private sector, and civil society, and then financing. In 2020, in the fiscal year that has just passed, we invested in 98 countries in health, total amount of more than $7 billion in projects that were delivered in the health sector across the world. And when we engage with countries, it's based on thorough analysis of their population health outcomes and the challenges of what they need to do to overcome in order to improve their population health, to get sustainable financing for their health systems. That means resource mobilization from their revenues or poor health taxes, which may have implications when it comes to NCD. For instance, the sugary taxes or nicotine taxes as well. The allocation of the resources to be efficient and be effective. Pooling of health financing so that they reduce the burden of health spending on their population and how they purchase healthcare for their people, including how they organize it in a mixed health system, which has private sector but also public sector being able to deliver. That's how we approach the way we advise countries in the partnership framework that we have with them, country by country. And NCD, as you've alluded in your report as well, I think illustrates why investing in health, investing in prevention, in care and rehabilitation is key to economic growth, is key to really healthy and prosperous societies. And that's the approach that we take.
Well, Dr. Pate, you correctly point out you were not a minister of finance, minister of health. And the reason that's important is because you understand that there has to be money made available to dealing with these issues in government. Williams, let me turn back to you. You heard what he said in terms of resource allocations, making some tough decisions on how to acquire resources. What is it that you think is needed by governments to address this issue?
Yeah, no, that's a great question. And let me, because I want to be very brief here, but also somewhat provocative. I think what governments have to recognize is this is really a multi-sectoral problem. It's going to require not only governments, but donors. It's going to require academics, and it's going to require our private sector partners to really form effective public-private partnerships that take a holistic approach, that is one that moves the action upstream from taking care of sick people. We have to keep doing that. But if we want to take a developmental and preventive approach to this, a multi-sectoral group of partners have to come together and prepare for using better data to precisely identify those places where interventions can yield the kinds of return on investment that are consistent with investing in health promotion and disease prevention and a stronger primary healthcare system to take care of those people who have NCDs that can be managed and their harms could be mitigated. So I'd say that governments have to be smart in partnering and strategic in investing in better infrastructure to promote health and wellness and have a primary healthcare system that is more equitable and effective in managing chronic diseases.
So it takes a village. You've got to have an ecosystem that comes together. You have to have the private sector. You have to have donor groups responsible for these issues. You have to have NGOs engaged, and of course, government. Dr. Pate, if you were to challenge the private sector, what does it need to do to help in this ecosystem? Because clearly the private sector wants to play a role. It's the innovator, it's a driver of change, but we need the support of government. So what do you think is the role of the private sector here?
Well, thank you. I think health systems are mixed in almost all countries. Within where they're publicly financed, the provision of healthcare has both public and private components, but there's a health value chain that exists in manufacturing and various services that are critical for delivery of health services. Private sector has three important areas that I would say are relevant to the NCD agenda. One, as employers, because the risk of NCDs in their employees, and take care of that, the preventative care, the adjustments in terms of workplace policies, the communities where they actually operate, those are also constituencies that they can actually support. The second bit is really around the skills and capabilities that the private sector has. You mentioned innovation, you mentioned management capacities, for instance, that the private sector has, supply chains, that private sector can help solve some intractable problems. We're seeing it in the COVID response, but we're also seeing that in some countries in terms of the NCD's effort. And then in terms of financing investments, in terms of manufacturing of critical items that are needed to care for those who are affected, but also public-private partnerships like Michelle mentioned. At the bank, we're working with Access Accelerator, which is a group of 20 multinational companies that are focused on expanding support to care for NCDs in many countries all over the world. Initial 6 countries, we're getting to 15 countries. That's an alliance that has the NCD Alliance, World Health Federation, and many others that are involved in it. In many countries, like Kenya, for instance, what we're trying to do is help use the private sector to screen patients that have NCDs, hypertension, cardiovascular disease, early on the preventative side. In Vietnam, it's more around the primary healthcare system being able to provide teleconsultation, especially in the era of COVID, how that can be done to deal with chronic care. In Colombia, it's really about dealing with patients that have comorbid conditions, but that's within the context of a partnership with the private sector, with the multilateral institution, and with governments. So it takes really a perspective that is multi-stakeholder to address this complex issue that is inherently multi-sectoral. It's economic, it's health, it's food, it's water, it's urban. All of those are interconnected. So that's the perspective that I think we need to take to solve this at the large scale.
Well, I'm glad you said that because it's not one sector of our economy that is impacted by this. So it's going to require all sectors across many industries to work together. And you don't have to be a pharmaceutical company or in digital health to understand the importance of having a healthy workforce. I want to give each of you a last shot at reflecting on where we are today. We have COVID-19. The focus has been on the recovery, the economic and health recovery. We do have a dynamic out there in which we have fragile states, mounting debt levels, and how are they going to make the investments necessary going forward? So if you have a parting shot, what would it be? Dean Williams, you are the first one.
2 really quick ones. COVID has made it very clear that looking at health and wellness through a public health lens is important. So public health means business. Public health is primary to our national security and our economic security. And then one last thing, when we invest in public health and global health, and we do it as a multi-sectoral activity, remember that what we want to do is create a culture of health. We want to promote health and wellness, preserve, protect, and promote health, as well as make sure we have primary health care that is available to all at the highest possible quality.
Thank you. That was very clear. Mohammed Pate, Dr. Mohammed Pate, what's your final shot?
I think very little to add after what Michelle said, but I think in this world, what COVID has taught us is that, in fact, it is in our enlightened self-interest to ensure that everyone gets access to the health services that they need. Every country. It costs $500 billion per month that this pandemic is continuing to the global community. It costs much less to have strong health systems that protects everyone, takes care of NCDs, but also takes care of other diseases that afflict people. So I think the voices of leaders from the private sector, the voices of leaders in the public sector and civil society will be very important as we emerge from the COVID-19 pandemic to see that investing in health is not just a privilege. Everyone should have access to high quality services that they need to survive and thrive. That is good for the economy and it's also the moral and right thing to do. So I'll stop here. Thank you for having me.
So thank you both for being here today. I want to encourage everyone to learn more about the impact that NCDs are having on a healthy economy, the impact they're having on the workforce, and to understand it in the context of what's going on today with COVID-19. Thank you for being with us today. Thank you, Dean Williams. Thank you, Dr. Pate.